Hello, Miriam Galdelli, sports massage and lymphatic drainage massage therapist. Hockey is the number one sport that is played in Canada, and one of the number one injuries that occurs in hockey is concussions. So, a lot of teams don't have an athletic therapist or physiotherapist or even a sports massage therapist working for them. So, I know that one of the major injuries that happens during hockey is concussions. So, I'd like to give you some advice for yourself or for your kids that can help you tell the signs of when you have a concussion and also to know when it's okay to go back to play. So, how do you know if you have a concussion? Your eyes hurt. Often you have trouble reading, you have trouble looking at a computer screen, you have trouble looking at a tablet or at a phone, especially on a tablet, on a phone, the electronics, they do tend to hurt the eyes even more than just regular reading. So that's one of the telltale signs. Are there headaches? If there are headaches, after being hit or after a certain impact, then that could be a sign of concussion. Are you experiencing a change in moods? So sometimes being extra moody or being extra tired or feeling depressed, that's another sign of a concussion. Another sign of a concussion is feeling nauseous. Another one is not being able to concentrate when in school. So as you can see, there are so many signs and symptoms to a concussion. Now, previously, we used to classify concussions as grade 1, grade 2, grade 3. But something that we've realized is that, number one, concussions are cumulative. So if you have a whole bunch of small ones, sometimes it can be just as bad as what we call a more severe one. So we've taken away these classifications, and we really judge concussions by how you're healing, how your rehabilitation is. So if you have suffered a concussion or if your child has suffered a concussion, I strongly urge you to make sure that the rehab process is going well. So you can seek a professional, somebody who specializes in concussion rehab. There are a couple of people in Montreal who I refer to and I work with the most. So if you do know somebody with a concussion or you've had a concussion, you can contact me and I will put you in touch with those people. You can seek the advice of your physician, but I also warn you, not all physicians keep themselves continuously up to date on concussion rehab, and they often still tell you to just rest for 2 weeks and you'll be fine. So before letting yourself or your child get back to full-on maximal exercise, it's very important that the person who has suffered the concussion is able to concentrate in a school setting or in a work setting. So that means being able to problem solve, being able to read, being able to concentrate for a full day before you should be considering going back to play. I urge you to please not follow the example of a lot of the pro athletes where they get hit and sometimes within a game or two they're back. This is their job. This is what they do for a living. They also do a lot of preventative work for concussions and their rehab starts right away. So what they do and what we do is totally different. So please make sure that if you do get hit, if you do have symptoms, don't brush them off. Just make sure you follow the rehab. Seek a professional. Consult people who may know how to rehab. If you know somebody who's had a concussion and who's rehabbed properly, contact them or contact me and I will put you in contact with the right people who can help you manage that concussion. So remember to take care of your body because you only have one.